Stakeholders in Nigeria's health sector have stressed the need for government at all levels to urgently prioritize the nation's healthcare system to reduce the growing burden of non-communicable diseases in Nigeria. Discussion centered around the need for increased taxation on sugar-sweetened beverages, legislation and effective implementation of existing laws were among issues highlighted at the Second National Conference on SSB Tax and Healthcare Financing, organized by the Federal Ministry of Health and Social Welfare in partnership with the Corporate Accountability and Public Participation Africa, CAPA. The report. Nigeria has for several years witnessed a high prevalence of non-communicable diseases such as diabetes, cancer, obesity, weight gain, kidney diseases and other cardiovascular diseases, accounting for about 24% of total deaths recorded every year. The consumption of sugar-sweetened beverages, also known as SSBs, which include carbonated and non-carbonated soft drinks, fruit juices, coffee or any artificial sugar-sweetened beverage, have in many scientific researches and studies been proven to be a major contributor to the burden of NCDs in the country due to its high consumption among many middle and low-income households who unfortunately have limited access to healthcare facilities. In 2021, Nigeria keyed into the World Health Organization's recommended taxation policy on SSBs as a cost-effective intervention to control the rising burden of NCDs in countries across the world by announcing the implementation of an excise tax of 10 naira per litre on all sugar-sweetened beverages as part of efforts to prevent and discourage its excessive consumption among Nigerians. Although the initiative was initially greeted as a welcome development, health advocates are concerned that the tax can no longer achieve the desired impact of curbing sugar-related diseases in the country. At the Second National Conference on SSB Tax and Healthcare Financing in Nigeria, organized by the Federal Ministry of Health and Social Welfare in partnership with the Corporate Accountability and Public Participation Africa, CAPA, stakeholders say an increase in the tax on sugar-sweetened beverages is necessary if Nigeria truly wants to be free from the burden of non-communicable diseases that have spanned decades.
Recent review and mental analysis of the International Diabetics Foundation show that as at 2021, over 3.6 million people are diabetic, with 53% of these citizens undiagnosed, and this number is expected to rise to about 5 million by the year 2020. The annual estimated cost of managing diabetes per person has surged from an average of 60,000 naira in 2011 to 800,000 naira in 2021, and it is projected to exceed 1 million by 2030. The goal of SSB tax is to reduce the consumption of these unhealthy beverages, ultimately preventing obesity and its related diseases.
After 2 years of implementing the 10 naira per litre SSB tax, we strongly advocate, based on available evidence, evaluating its impact, that the Nigerian government activate all necessary policy measures to increase the tax from 10 naira to 130 naira per litre, or implement a completely revised tax structure to 50% of the total retail price of SSB as recently recommended by the Global Task Force for Health, of which our Honorable Coordinating Minister of Health is a member. The adjustment will not only align with the WHO's recommendation and global best practice, but that 2024 report on effective health taxes. Additionally, this agreement was accompanied by a redefinition of SSB to capture all products that were excluded in the initial categorization.
Now, there is a myth about taxes on sugar-sweetened beverages, that it is intended to be a burden either to the public, the economy, or government, or even all three. But I would like to share today that, on the contrary, SSB tax is a pro-health tax targeted at improving health outcomes and boosting the economy if you have the right tax set and well implemented.
We must strive to create an environment where healthy dietary choices are the norm, supported by appropriate policies and robust health systems. Healthy diets are crucial for promoting health, supporting active lifestyles, and preventing diseases, including both communicable and non-communicable ones.
Stakeholders say an increase in the current SSB tax from 10 naira per litre to 130 naira per litre will create an additional 900 billion naira in revenue to finance the country's health sector for the prevention and management of NCDs.